On direct examination, Dr. Stephen Shafer, expert, final witness for the prosecution. Let's listen in.
Resuscitation equipment available. I've only done mouth-to-mouth resuscitation once in my life, and that was in a hospital when I was the first responder to a patient who had arrested, and I did mouth-to-mouth for about 60 seconds until the rest of the team arrived with the proper mask and bag. Because for a healthcare provider, mouth-to-mouth resuscitation is a demonstration, an admission that you don't have the equipment you need to properly move oxygen in and out of the patient's lungs.
And for a doctor then, because you differentiated between a layperson and a doctor, for a doctor in this situation that took place in this case, then the bag mask ventilation would be the standard of care?
Yes.
And because that's essentially more efficient at moving air into the patient?
That is absolutely correct. It's much more efficient. When you breathe into a patient's lungs, that's your expired air. The oxygen level in room air is 21%. I believe that the oxygen level coming out of your own breath is just 18%. You've lost a lot of the oxygen already that you're putting into the person's lungs. They need more oxygen. They don't need 18% oxygen that you have expired.
And that was a serious violation?
Yes.
Now, assuming what Conrad Murray said is true, that he was gone for 2 minutes and came back and felt a thready pulse, those are his words, could proper care at that time have saved Michael Jackson's life in that scenario?
Absolutely.
And again, that goes to the need to ventilate the lungs.
With oxygen.
Now, do you recall in Conrad Murray's statement where he describes raising Mr. Jackson's legs?
Yes.
I believe you characterized that as a minor violation?
Yes, it was just a waste of time. I don't know why he did it.
And that's what I want to ask you about, because you did note it in your report. Why do you characterize that as a waste of time that Conrad Murray raised Michael's legs?
You would raise a person's legs if you believed that they needed more blood going to the heart. So if a person has had some sort of traumatic injury or a gunshot wound or something like this, it's certainly a very reasonable thing to do. But that's not the case here. There's not a problem with too little blood in Michael Jackson. So you would raise the legs to transfuse more blood to the heart. That's not the problem. The problem is he needs oxygen in his lungs. And even thinking about raising the legs, to me, just suggested that Dr. Murray was quite clueless as to what to do. It doesn't make any sense. It's not treating anything that needs to be treated in this setting.
For what is flumazenil used?
Flumazenil is a drug that can reverse or antagonize the effects of any of the Valium type of drugs. That would include lorazepam, that would include midazolam. And intravenous flumazenil is essentially an antidote that can quickly reverse an overdose of those drugs.
And in this scenario where Conrad Murray admits to giving, over the course of time, in his words, 4 milligrams of flumazenil, 4 milligrams of lorazepam, was it appropriate then to give him flumazenil, and did you draw any conclusions from that?
There was nothing wrong with giving flumazenil. It might have been useful, but 4 milligrams of lorazepam given hours before would probably not require reversal. So I thought it curious, given the description of only giving 2 doses of lorazepam, each quite small, that he would choose at this critical moment in Michael Jackson's life to give a drug to reverse lorazepam. It doesn't fit.
Does it indicate to you in your review of the records that Conrad Murray was aware he'd in fact given more than 4 milligrams of lorazepam?
That was my interpretation. That he knew he'd given a lot of lorazepam, which is why he very quickly reached for the antidote to lorazepam. He knew that Michael Jackson had had a lot. That was my conclusion.
Dr. Shafer, you speak about then the failure of Conrad Murray and the deception of Conrad Murray in that he did not reveal to the paramedics that he had administered propofol. And additionally, he did not reveal to the UCLA emergency room team that he had administered propofol. Did you find that to be a deviation from the standard of care? And if so, how would you describe it?
That is a egregious deviation from the standard of care. When a person's life hangs in the balance, as it did, to withhold information is inexcusable. And he withheld the information about the propofol. He also mischaracterized this as a witnessed arrest, which is very different from what it was. A witnessed arrest is usually not an arrest for lack of breathing. A witnessed arrest is usually something like a heart attack. You see the person and suddenly they're down and something catastrophic has happened. Particularly when a physician has witnessed an arrest, you assume it's some sort of cardiac disaster, because in the presence of a physician, a patient should not be allowed to not breathe when a physician is present. So a respiratory arrest, the cessation of breathing, that is assumed to not have occurred in a witnessed arrest when a physician is present. So the therapy that was directed towards Michael Jackson was therapy towards a cardiac event that was unclear. And the fact that this was a respiratory arrest and that it was caused by sedatives, and specifically by propofol, was withheld. So that neither the paramedics nor the physicians at UCLA knew what they were treating. A patient comes in an arrest, you have only seconds to go down a treatment path one way or the other. They were not given the information to choose a treatment path appropriate for what had happened. That information was withheld.